A doula is a wonderful asset to have in a birthing experience. But what is a doula? A doula is a companion that is a support for a birthing person during labor and birth. And so, what kind of support do they offer? So, they offer four core pillars of support. So, that is physical support, emotional support, information support, and advocacy. What they do not do is they do not provide any medical advice. They do not perform any medical procedures, such as taking blood pressure or analyzing or checking the birthing person's cervix. They do not catch the baby. Pretty much they don't do the things that the nurses do. What they do is offer that emotional, physical, informational, and advocacy support. So I'm going to explain those. Physical support. So some physical support things that they can do is they can have soothing and gentle touch for toward the birthing person. So that could include some nice massages to help bring down the pain for the birthing person. Soothing touch that helps them to feel comforted. Um, just different kind of touches that the birthing person warrants. So it needs to make sure that the birthing person wants to be touched in that way, um, so that the birthing person doesn't feel uncomfortable. And emotional support. So some emotional support that the doula can offer is encouraging words, of course, helping the birthing person to feel confident and capable in their abilities. Um, and their physical capabilities, as well as helping the birthing person and the birthing partner, like the father in the situation, um, helping them to have a surety that everything's going to be okay and that they are doing great, that the baby is fine, so long as it's the truth, right? So helping them to be assured that everything is going the way it should be going or needs to be going for them. um, and then for informational support, they can offer birthing tips. So certain ways to like certain birthing positions that could be helpful, or certain different explaining procedures that are going on, or explaining different things that um, the doctors or nurses don't take time to explain. Um, and what I mean by that, I'm not saying that they go into medical things and talk to them about medical things. But for example, the nurse may be on the computer doing something and the doctors are busying around, and the birthing person and the birthing partner are kind of like, wait, what's going on? It's chaotic in here. What's going on? And so the doula can inform the birthing person and the birthing partner about what's going on, and what they're analyzing, and kind of like a general summary of how they are helping and how they are there for um, in helping, the birthing person and the birthing partner. And advocacy is, I want to assure that it's not speaking for the birthing person or the birthing partner. It is not, you know, I guess, taking over. We never want to take over as doulas. As a doula, they can advocate for the birthing person by making communication between them and the doctors or nurses flow well, and making sure that the birthing person and birthing partner are heard, and that what they say is being considered, greatly considered, and generously considered. um, and so for example, um, a doctor brings out scissors, and seems to have an intention to do something with them, with the um, birthing person. So, as an advocate, the doula could say and look at the client and say, I see that the doctor has scissors out. Now would be a good time if you have any questions about, scissors, or about what he may be doing. Now would be a good time to ask about that, and maybe share any concerns that you may have about anything that he might say. So it's just helping, the birthing person and the doctor to have that flow of communication, and make sure that the birthing person is having the birth experience that they desire. Um, and doulas have shown to have great benefit. Um, so in the birthing experience, doulas having a doula, or that continuous support throughout the birthing experience, has shown to decrease the amount of cesarean births, has shown to increase the amount of the feeling of positivity of the birth experience for the birthing partner and the birthing person. Um, and it has shown to have many more effects, including positive effects, including um, having a better APGAR score after the birth of the baby, um, and just lower risk problems, a lower it's been associated with lower need for pain medication for the birthing person. So lots of wonderful benefits of a birthing doula. And so that is a doula, and I believe that every birth, if available, if possible, that the birthing person could benefit from having a doula.